Palm Beach Orthopaedic Institute is a full-service physician practice focusing on the orthopedic care of our patients.
One of the biggest problems we were dealing with was our Monday morning inbound call volume.
We were getting a lot of feedback about not being able to access us through our phone system, having to wait a long time on hold.
We were looking for a solution that would allow us to communicate with our patients bidirectionally instead of just us sending a message to a patient.
Well Health software is a bidirectional texting platform that allows us to interact with our patients across a wide variety of questions and issues through their typical text messaging process. So this is much more helpful to patients and much more natural to how they would want to interact. And they also text our mainline number, which means they don't have to learn or access a different number for our practice. On the practice side, Well Health is a software platform they're using on their desktop computers, and it allows them to communicate securely with a patient in that text format.
Whatever we are responding, and we can give them the most up-to-date, most accurate information that we can, as long with any other questions that they may be asking, whether it's a reminder or more of a clinical question.
By using Well Health, we've been able to really expand our access to our patients, and it's allowed us to really manage all of that with virtually no change in staff size.
I think patients have been extremely satisfied to have an open line of communication with our practice at any time, day or night. We might be closed when they think of that question at 11 o'clock at night, but they can still send it to us. And when we open in the morning, we can reach back out to them. We have found that patients text us about everything. Initially, it started with just our scheduling team discussing whether they could make it to their upcoming appointment or if they could cancel or reschedule an appointment. And we found that patients were beginning to ask us a lot more questions that were clinical, or they would ask us a question related to our billing department. So we really started opening up other departments into Well's system, and it's really taken off from there.
Most of our patients are very busy with work or school, so if we leave them a voicemail, they may not necessarily pick up that voicemail, or maybe they don't have their voicemail set up. I would definitely recommend Well Health to other colleagues in the healthcare industry to give them a broader access point for patients to communicate with them.